What happens when two of the most plugged in people in digital care team up to try and make sense of some of the chaos? Welcome to Control Plus Care. I'm Michelle.
And I'm Katie.
This is your weekly briefing on the most important digital care topics and updates. We're unpacking what you need to know this week and every week in under 30 minutes. But first, Katie, how are you?
Yeah, really good, thank you. Not had to travel at all this week, which has been nice. Had a time at home. How about you?
Also been home. In fact, what I did is I made everyone travel to me this week because I had half the team come up to Liverpool to do some planning and strategy day, and that was a delight. I will be doing more of that for sure.
Well, I love getting everybody to go to you, get people out of London.
It never happens when you're up north.
No, definitely not. More representation for Liverpool, I think, going forward.
Absolutely.
Right, so today we promised that we were going to talk about Fit for the Future, the NHS 10-year plan for England. And we're going to caveat by saying we're really only talking about a portion of chapter 3, which is the digital chapter. We said less than 30 minutes, and there's just not a chance that we would be able to do the entire thing in less than 30 minutes.
And we had a tough time pulling down exactly what we were talking about because there is actually so much in there. You know, we wanted to look at the neighbourhood health hubs because they're going to be really tightly linked to social care. Obviously, we've got the Casey review coming, how that is going to tie into this. And there was just tons and tons in there where my eye went instantly to, that's great, but how's that going to fit with social care? Which is the question that's always on our lips.
Yeah, exactly. So we've decided we're going to narrow our focus down to sort of two of the big sort of digital commitments. Social care are mentioned in both of them. While this is the NHS plan, there are at least 4 mentions of care providers, which is quite exciting, in 168 pages. So we're going to talk, I think, first of all, about the single patient record, what that means, how we feel about it being called a patient record, it's probably, and then come on to the changes around the NHS app as well, because they're a whole new wave of functionality, and some of that's going to be really exciting for social care. So, Michelle, should we start with a single patient record then?
Yes, a single patient record, which we will all have. Very egalitarian.
Exactly. So it's going to be a place to bring together everybody's medical records all in one place. And the first thing I wanted to point out is, so we have really clearly in the whole plan that clinicians will have secure access to this. Understand importance about data governance, but currently with GP records and sort of broader health records, it's not just limited to clinicians, right? You know, a receptionist in a GP surgery has access to a portion of your records to be able to triage that. There are lots of people who are not clinicians, but who are still professionals working in health and care who have access to the records. So I think, obviously, from a social care perspective, where we have fewer clinicians in general, if we're going to also be inputting into a single patient record at some point, that's something that's really going to have to be considered and how the governance of that is managed.
Yeah, and I think the interesting thing there as well is we are actually, social care is in many ways a sector that is, I don't know what the word is, declinicalizing. We know there are fewer nursing homes than ever before. There are fewer nurses working in social care than there have been. There is a big push to professionalise the care workforce, to have that parity of esteem with NHS, and that's a bigger thing than is going on here, but they're really pertinent conversations. And as you say, when we've gone through conversations around EMR and proxy ordering, we've already had these conversations about you can't just say the word clinician and not think it means something.
Yeah, exactly. And I think for me, the most logical step is sort of a continuation of what we've already seen with the shared care record programs, right, across local integrated care systems, where you've had sort of role-based access controls for certain people from social care being able to access portions of the record, which is relevant for the work that we do. I mean, nobody needs to see the entirety of the whole thing if it's not relevant. But there are already sort of processes which have been established, which are working, which are being tested, which potentially could be rolled out nationally here.
Well, you'd already want role-based access anyway from a cybersecurity point of view. You don't ever want everyone with access to everything. That's terrible, terrible cybersecurity. So there is already a model for it. We already understand how it works on other systems. So, I get, again, whilst it is a 160-page document, it's only 160 pages to talk about everything. So clinicians may just be a shorthand for everyone, but you try telling a clinician that anyone who isn't clinical can come under that badge. And I just think there's a lot of ambiguity in the description that word clinician is not an ambiguous one.
Yeah, I absolutely agree. But the extra bit then on the single patient record, which I have just put in my notes, wearables, exclamation mark, because I was really excited actually to see this. It's something we've spoken about for a long time. So we know many people wear smartwatches. For anybody watching the video, there we go, got them both of us up. Different brands. We're not endorsing a specific one.
No.
People have lots and lots of wearable devices, body tech sensors, all of the time are collecting data. So in the 10-year plan, it says that where these have been clinically tested, there will be opportunities for people to be able to input their own data they're collecting through wearables into their own patient record. I think this is something which is incredibly exciting to be able to offer to people, where you can have more choice and control over the information that you are collecting yourself, and use that to help the various health and care professionals you'll be working with and who maybe were part of your care plan, and choosing who can have access to that. It's cool.
Yeah. I mean, I want to know whether my badges from my Apple Watch go with it, because if I'm going to give them my step count and my fitness numbers, I'm also going to want them to see my badges. But again, we always come back to this conversation about we collect so much data that actually the wearable stuff is stuff people are happy to collect themselves. And yet that leap from I'm collecting an awful lot of data to it being used in the health system has felt insurmountable. So yeah, this is definitely one that's worth keeping an eye on. And I think that clinical safety element, getting things tested, understanding what that means, because there's going to be a lot of new tech coming onto the market. And if it can be clinically tested ahead of time, then they're not having to catch up later.
Yeah, absolutely. And that part is going to be really, really important. I mean, if you break it down to as simple as the difference in the accuracy of GPS if I'm on a run on my watch as opposed to on my phone, where my phone does not cover all of the meters that I'm doing, and so makes me run at least a kilometer more, and I don't like it. Having that sort of, these are collecting accurate data, you can use these ones might be fine for home use, but you're not going to put that into your patient record. It's going to be really important.
But you may not put it into the record from the clinician's point of view, but I think having, the trends of somebody's activity, whether it's going up or down, it doesn't have to be, we know that Mrs. Jones has taken 6,000 steps, but we could be saying she's taken about 20% less than she was. What's going on here? I think that's really useful, especially if we're looking at this move to preventative care, this move to neighbourhoods, this move to people having control over their own health, so that we are not overwhelming a system that can't cope.
Yeah, absolutely. And also then, if we're sort of having this data, the fact that that will be presented back to us, that people will be able to have access to their full health records by about 2028, depending on parliamentary terms, there's a commitment that patients will be able to view everything directly within the NHS app, which that would be an absolute game changer for many people who still really struggle to access portions of their record, of their test results and that sort of thing.
Yeah, I mean, I said this to you guys a few weeks ago when I discovered blood test results in the NHS app. I then had to go and Google what they all meant. We need to do a translation piece, because if we're going to make information available to people, we have to make it understandable and transparent. And at the moment, you're just given raw numbers and various words. But Google helps with that. But I think the idea of people feeling like they're part of their own care team, that they're part of their own health picture, is incredibly empowering.
Yeah, absolutely. I mean, I tend to just annoy my nurse and doctor friends with things like that, and they love being asked in the pub to do work for free. Obviously, they do. But I think we'll probably come on to that a little bit more as well when we get to talking about the NHS app and the upgrade specifically. But just before we move on from single patient record, then, there is also information that new legislation is going to be introduced that places a duty on every health and care provider to make the information they record about a patient available to that patient within the app. Obviously, there's longer timeframes associated with this. That, to me, I'm not really clear on the detail of the things that I was thinking about here is, people have the right to see their own records already. You know, people can make subject access requests. CQC want you to be sharing people's care plans and co-producing them with them. So if it's strengthening the legislation around that to make it make sure it's even clearer that that's something people must have, I think that's really helpful. But there isn't enough detail, for me at least, around this about what this new legislation might mean.
Yeah, I mean, there's a couple of things I'd want to see in it in terms of, really clear timeframes that are manageable for the system as well as useful for the person. Because I know certain people who've had like 180 days waiting for a subject access request. Well, if you're needing that for a specific purpose, 180 days is a really long time. Equally, the format in which, if you're someone with multiple conditions in receipt of multiple services, there's a risk of being overwhelmed with information in a format that is unusable to you. So hopefully the legislation clears up some of those things for me.
Yeah, definitely. And defines what is meant by health and care providers as well, because potentially the likelihood of a social care provider being able to make patient data available in the NHS app in the short term might be quite limited.
Yeah, I mean, there's definitely a tech talking to tech issue there.
Yeah, for sure. So the NHS app, or which I thought on my first read through was going to be a whole new suite of NHS apps, but I think actually it's additional functionality. So there's going to be huge upgrades to the NHS app, what it can do, and the different areas that it's going to cover, which is going to be relevant to different people. We talked last week, I think, about how now the largest user base, most frequent users of the NHS app are people over 65, which is absolutely amazing. And I've not been able to find more recent stats on it, but I believe over 75% of English adults now have signed in and have access to the NHS app. So this is more widely used than Netflix, which is crazy. Yeah. I'd love to see the stats against like BBC iPlayer. I feel like that would be a good...
You want to see it against a whole suite of streaming services?
Yeah, that is exactly what I'd like to see. Basically, I want a ranking of all of the British apps and how they work.
The Venn diagram of how many people listen to the Archers and how many people access the NHS app is a really fundamental piece of data we're missing.
Absolutely. It's so vital to the continuation of our programme. It's actually a circle. Everybody who's an Archer
It's very tight. It's very tight.
Exactly. Right. So NHS app, most people know what it is. You've obviously accessed it recently, Michelle. I don't know if you want to do a very brief, this is what NHS app can currently do.
No, because I just used it to look at my blood results. So my access to the functionality was just that one thing.
Yeah. It is a bit different, I think, depending on your GP surgery at the moment, how much data you can access through it. So my GP surgery, I can't access my records, but I can access blood tests and I can see repeat prescriptions. But the plan is that people will be able to use it basically as a one-stop shop to manage everything to do with your health and care, which could be, I mean, for me as somebody who just likes one app that does one thing, sounds absolutely amazing personally. So the main one that I wanted to touch on first is the My NHS GP, because I think this relates to what we were talking to before a little bit. So it's a single trusted source of instant advice for people. It's going to be sort of developed with clinicians and can do some of that explainer piece. So I am imagining something very similar to when you look up a specific symptom or something on the NHS website right now. It can say, oh, this is what causes it. This is when you should be concerned and whether you should access emergency services. But to do that basically as an AI GP in your pocket, which could be really good.
Was it triage, I wonder? Because that really would... Well, on the one hand, as we always say with these things, on the one hand, it could really free up resource.
Yeah, absolutely.
On the other hand, people could get missed because people can't reliably use triage systems. But
yeah, and I mean, there's always the things with triage systems with how accurate they are. I mean, I remember a couple of years ago, I managed to trap a nerve in my neck, but when I put my symptoms into the sort of self-referral app online to get a GP appointment, it kept flagging that I had to go to A&E, basically, because it's also the symptoms I'm having were the same as meningitis. I definitely didn't have meningitis C. It definitely was just a trapped nerve. But, there's always flaws in these systems. But presumably we're talking about an AI system, which would be learning over time and could be getting more accurate. And particularly for non-emergencies, I think this could be something which is really, really helpful, helping direct people to resources like going to speak to your pharmacist, for example, going to a minor injuries unit, rather than necessarily having to present at A&E if that's not something which is relevant for you.
And from a social care point of view, that just opens up access for, care providers to be able to make sure that the people that they are looking after and caring for get seen and get the right information in a timely manner. Anything that keeps them, in their home, not having to travel to hospitals, not having to travel to doctors is only going to be a good thing.
Yeah, exactly. And I'm going to sort of bundle the next three pieces of functionality together, because you've got my choices, my specialist, and my consult. That's the one. Sorry, they all start with my, so I was trying to keep track of them all. And so all of these are about that choice and control thing and putting that power back into people's hands about how their care is delivered. So my choices basically would be a list of different health and care provider options with reviews, how they're doing, much more live feedback, so people have more access to information about the healthcare providers that they might be using and opportunities to provide feedback on that.
Like TripAdvisor for doctors.
Exactly. Yeah.
Interesting.
Very interesting. I'm sure lots of healthcare organizations are quite concerned about this. It is tied later on in the plan to potentially links to funding, dependent on your reviews.
Excellent.
There. But we said we're just going to focus.
Yeah,
we're just going to focus on chapter 3, though. I'm sure there will be lots from various medical organizations on that. Yeah. And then my specialist is where you can self-refer to speak to a specialist for a consult in certain situations. So you don't need to go see a GP first. You can get that referral directly through the app. Right. And similar to my consult, where you can ask for a remote consultation, a virtual consultation with somebody to have that initial conversation to then be signposted onto more specialist resources if you need to. So all of that just gives you a lot more freedom and flexibility, but also potentially really takes that pressure off the GP being the single source if you've got to get that appointment to speak to that individual.
And does like a dual thing for social care, does, as I said at the start, keeps people where they live for more of their time. Great. We know that keeping people with multiple morbidities, with frailty out of the system is what keeps them healthier. And also, does that job of drawing social care closer to the health system? Because you can imagine in, say, supported living or a residential setting, the staff would have a lot to do with this, with supporting individuals. And, when this is rolled out, I'd like us to, we certainly will have plenty to say about the role of the care worker in the use of these things, because where we have individuals who lack capacity or, don't have the communication skills, all of this means that care worker is really integral in the person's ability to access what's available to everyone else.
Yeah, exactly. And that's something I think we definitely as a sector need to think about with the My Carer part of the app. So for children, for example, or for people who are cared for by a friend or family member, there will be a My Carer app for those people. But it doesn't appear to be set up for more formal carers who may also have that role to be able to help people manage their own health records. So I think that's something, obviously, as a sector, we'll want to have a lot of say in how that happens.
Absolutely.
Yeah. So then there's also My Care, distinct from My Carer, which is really for people with long-term conditions and other sort of complex needs. It sounds sort of really, really helpful in terms of keeping people's preferences in one particular place. And that's a key part of this. But the bit which I sort of flagged in my notes on it was that currently it'll be around access and referrals to NHS services. And over time, it will increasingly link to voluntary sector, social care, community groups. And it will be a digital social prescriber, is what it says, which sounds amazing. But I guess it's, what are those timelines going to be?
Yeah. I mean, does that one hand where you want them to get it right for the NHS first, really before they rope all of us into it, but also you don't want that over time to just become interminable so we never get access to it, or this gets replaced by something else.
Yeah.
In year 11.
This is it. We don't want it to sort of be like perfect for the NHS, but still massive
Still.
chunk missing. And then potentially my favourite bit of functionality, which given that this is hypothetical functionality which doesn't exist, I appreciate the like kind of irony of that. But there's part of it which will be called My Companion, which is really to help people to articulate their own needs, preferences, and wants. It will support people who maybe feel less confident in their own health literacy to with questions they might wish to ask the clinician that they're speaking to, the professional that they are speaking to, can help with methods of staying calm and supported during an incident that you have. And I just think this potentially could be really, really empowering for people, particularly if you've got a lot of health anxiety or potentially if you've got a disability, which makes it more difficult for you to communicate your needs. This, I think, it could be very exciting.
This is the most human-centered piece of the plan for me. And I say that even considering the other chapters, this is the thing that really puts, we talk about almost the burden of people keeping themselves healthy a lot in this plan. This is the only place where I can see that we talk about helping them do that in the bigger system. So yeah, it is hypothetical, but I think if we could get this right, this could change not just how we do health, but how we do public services.
Yeah, exactly. And I think that really speaks to sort of the end of this chapter. There's a real commitment to co-creation of what these things look like for people. I know there's already been extensive consultation with patient voices and many others. And hopefully that's something that will continue, and people in the sector, particularly people who use care and support services and their friend and family and carers, will feel that they can become part of.
This is something where health can absolutely learn from social care, because there is just so many examples in our sector of people doing this in such an authentic, long-lasting and meaningful way over a really long period of time that tends not to happen in health. So it's nice to see the commitment there. Our sector, I think, would be quite happy to share what we know already now.
Yeah, definitely. So I guess our final sort of wrap up on the 10-year plan, which again, there is a lot more in it, is cautiously optimistic. There's some real opportunity here for social care to make a really meaningful change in pulling some of this off. And I think we need to really reach those opportunities as they come up.
Yeah, I think my takeaway from the plan is that it felt truly transformational and ambitious. And I get that a lot of the detail on the how is missing, but we've all seen these plans come and go without that sense of urgency. And I think there's just so much in there where social care has an opportunity to, keep our identity as social care, because I think that's really important, whilst also moving closer to our partner in this system.
So we do have a couple of rapid fire updates just before we sign off. So one I did want to mention is there is a new research project which University of Sheffield are just starting, which is looking specifically at the use of more sort of mainstream consumer tech for people with learning disabilities, adults with learning disabilities. And to kind of explore things that you would buy off the shelf. So, your Alexas, your various smart sensors, your smart kettles, which ones really work for adults with learning disabilities and which ones don't. And they're currently recruiting people who use care and support and also learning disability care providers to knowledge user networks. So if you are interested in getting involved in that research, contact us, I guess, Michelle.
Yeah, we'll have the link as well in the show notes, so follow that.
Yeah, exactly. Also had ADASS Spring Survey, which was published on, I want to say the 15th of July, which covers digital technologies a little bit. Obviously, it is a broader context about where directors of adult social services are currently. But some really interesting things about technology. I think particularly I would recommend looking at a short summary of this, which is again linked in the show notes, where it talks about the confidence that directors of social services have around emerging technologies. Very, very high for remote monitoring, smart sensors. Actually, only 32% felt confident around AI, which, given how prevalent that is right now, really interesting stuff. And then I wanted to finish on a funny one just because it's something that I know bothers you, Michelle. So we all know sort of AI voice tools do that weird Americanized accent all of the time. So there's actually a British company that has now come out and they do regional accents more accurately. So for the Scousers amongst you, you can have a Scouse accent on your AI assistant.
It's never going to get it right. So what I think they just use my voice.
You'll just talk for everybody.
I'll just talk for everybody. Send me what you want said in a text message and I'll just read it out. That's the only way we're going to get a Scouse accent right. But I do admire the ambition.
Exactly. And I think it's really interesting to have more regional accents available. I mean, as somebody with the most bland British accent of all time can't relate, but great. But I think the thing is, obviously, from a cyber safeguarding perspective, this does open up more risks, doesn't it?
It does, because we are living in a world where deepfakes are incredibly accessible, incredibly easy to do at the moment already. I can literally, if I had 2 handsets here and a free app, I could recreate you with your very bland accent, Katie, and phone your mum and convince her that I was you. So, and we're always on this tightrope, aren't we, of like, just because we can, does it mean we should?
Exactly.
So, yeah, it does, as with all of it, raise some big questions about cybersecurity and the ability for people to be scammed.
And that's something I think as a sector we're going to increasingly have to think about how we tackle. What's our responsibility for supporting our own staff, as well as the people we support, to recognise sort of the power of these AI deepfakes, just, to add an extra bit of pressure on at the end of the week.
Just another thing to worry about.
Yeah, exactly. So that is our rapid update section, all finished.
Fabulous. Well, there we go. What happens when 2 of the most plugged in people in digital care team up? We demystify care and you get control plus care.
Subscribe now on YouTube and on Spotify, and all of the links that we've mentioned in here, plus some other ones we may not have got round to, will be in the show notes.
And if you haven't already, tell a colleague, especially if they're one of the 25% of adults in England who haven't signed up to the NHS App yet.